What if I told you that next week you could save someone's life? What would you imagine? A dramatic, heroic act? Maybe. But what if I told you you could save someone's life simply with your words? I lost my mum to cancer when I was 13, and in the years before and after, I dealt with the mental challenges involved with that. Over time, I came to understand the importance of managing my physical and mental health. And while I'm clearly no athlete nor therapist, I am someone who truly cares about people's well-being. And through my work in communications, I understand the power of words and their influence on people. Through work, I've been exposed to many different types of businesses, and I've come to understand how some businesses can really support people's well-being, while conversely others can cause people's well-being to suffer bit by bit by bit. Our workspace, our mental well-being, and our physical well-being are intrinsically linked. On average, we spend approximately 50% of our waking hours at work, so it has a significant impact on our lives. Workplace well-being has been around for decades, and it's no new phenomenon. But it is traditionally focused on tangible outputs. Workspace ergonomics, access to gyms, fun, relaxing spaces where we can take our breaks, and healthy options at the canteen. This is all commendable, but is it enough? Our workplaces can play a huge role in contributing towards our ill health, so they must play an imperative role in helping support and encourage positive habits. Our workplace wellbeing agendas can sometimes include promoting awareness, popular awareness months, such as breast cancer awareness and Movember. And I truly believe that these are two very significant causes. Yet, the cancers covered by these only account for 20% of the 18 million cancer cases globally, and just 11% of the cancer-related deaths. So what about all the others? Well, there are 4 other cancers: lung, colorectal, stomach, and liver cancers. And together, these are far more severe and account for a staggering 44% of cancer-related deaths. Why don't we talk about these? Wouldn't it be great if we could help prevent more cancer cases, helping more people? The World Health Organization state that 30 to 50% of cancers are currently preventable. And these prevention strategies are lifestyle-based. They include no tobacco, healthy eating, including fruit and veg, regular exercise, and reduced alcohol consumption, as well as reducing exposure to radiation and air pollution. Yet we talk a lot about cancers, but the world's biggest killers are actually cardiovascular diseases. They account for double the amount of cancer-related deaths, almost 32% of global total deaths. Yet the WHO also state that these are also preventable with lifestyle choices. Again, no tobacco, healthy eating, regular exercise, and reduced alcohol consumption. Yet, what do we do when we're feeling pressured, stressed, and busy? We stay glued to our workstations in sedentary positions for hours, especially for office workers. We don't prioritize finding healthy food. We grab whatever we can. We don't make time for regular exercise. We're too busy. We often turn to substances in the evenings, like alcohol or tobacco, to ease the pressures of our day. And we often isolate ourselves to focus on getting the work done. Yet it's not just the physical health that this affects. The Mental Health Foundation states in their top tips for improving mental health that we should also consider healthy eating, regular exercise, being wary of the effects of alcohol and drugs, and also prioritizing sleep and talking to people that we trust. So while the physical workspace is important to be a healthy one, actually our HR and communications teams can play a crucial role in educating our staff about healthy lifestyle choices that not only will help them lead to happier, healthier lives in the short term, but also prevent longer-term fatal diseases. Their words and their types of communications can have real purpose and impact. Yet it's not for the businesses to tell us how to live our lives. It's for the medical institutions, right? Well, according to Elderman's Trust Barometer, businesses are recognised as the most credible and trusted source of information today. So as communicators and influencers to our workforce, we can and should give them meaningful and purposeful advice. And this advice from businesses can affect millions of workers, billions of workers globally. We can also create workplace cultures where it is actively encouraged to support our healthy lifestyles, not where we can't fit it in between our unhealthy work habits. Yes, I know there is a concern that these types of communications can come across as irrelevant and condescending. So how do we get the balance between promoting healthy work lives and stopping it from coming across as dry, unimaginative content that turns off the viewer? Now, I would say this, but it is through our words. By using creative messaging and striking design, we can assure these messages are delivered and received so they make an impact. They can impact your entire workforce and their networks. Mental ill health is a growing cause for concern. In fact, a Deloitte report in the UK stated that mental ill health costs UK businesses £56 billion a year, and that cost has increased by 25% in the last 3 years. Mental ill health is a major factor in long-term absence. It accounts, along with stress, for 95% of the reasons people stay away from work. But it's not just absence, it's also presenteeism, the notion that people turn up to work but aren't productive due to their illness. It costs businesses billions. Workplaces can do something about this. In the same Deloitte report, they reported that for every £1 businesses spend on mental health intervention, they will receive £5 in reduced absenteeism, reduced presenteeism, and reduced staff turnover. It is a win-win for everyone, employees and businesses. Yet, there's a real stigma in talking about mental health, particularly in the workplace where we're trying to be our most professional selves. Employees are scared to talk about it and admit their mental challenges for fear of being seen as inferior to their colleagues or just scared of being judged. And managers feel ill-equipped to have these conversations. They don't know what to say, how to deal with the situation, and prefer to just avoid it altogether. But suppressing these conversations and these feelings will only make matters worse. Movember, who also support mental health, state 3 words: talking saves lives. So what can we do? Let me tell you a couple of stories. Mark works in IT in the US. He suffers from panic attacks that send him to the toilets for 15 minutes at a time. And he suffers from depression that can stop him turning up to work. He chose not to tell his employer about this for fear of being pushed out and judged. Yet one day, at an important meeting, he fled to go to the toilets for a panic attack. After this meeting, his manager came to him and asked for a private meeting. He thought he was finished. Yet his manager chose not to take him to her office. She took him to the cafeteria, bought him a coffee, and talked to him about his life, not work, and asked him how he was doing. She created a psychologically safe space in which he felt he could talk. He opened up. He started to trust her. And together, they worked out how he could work and succeed at the same time. They met regularly, they worked on what he needed to work on, and he started to grow in confidence and motivation. He began to take on new projects and got a promotion. With her support in the way that she created a psychologically safe space and opened up the opportunity to talk freely about his mental health, he no longer had to mask it, and he started to excel. The Chartered Institute for Personnel and Development in the UK state that the key link in the employee wellbeing chain is the role a supportive line manager can have. They state that creating a trust-based relationship where people can feel that they can have open conversations about their wellbeing issues is crucial. Yet they also state that they can only have this education and skill to be able to do this by having effective training and support and guidance that they can only receive if senior leaders really push this as part of the agenda. David is already a leader. He's a leader at PwC. He became a partner at a very young age. He took everything in his stride, finding everything easy that even other partners found challenging. Until one day, things started to get more tough. He struggled with the everyday today. He'd never done that before. He was dealing with some challenges that he'd dealt with, but he'd always dealt with them very easily previously. But combined with an intense work role, suddenly he started to become unhappy, always. He got to a point where, on holiday, he completely broke down. He started to have panic attacks as well. He started to cry on a regular basis and couldn't deal with the day-to-day. He couldn't even send emails. Things got so bad that one day driving, he decided that he was going to attempt suicide. Thankfully, last minute, he swerved to safety, and his children still have his dad today. That moment was a turning point for him. He learned to open up, talk about his feelings, and he's now doing very, very well after seeking the right support. He's still a leader at PwC, and today he is a mental health champion. Through him, PwC now put mental health at the top as a priority within their health and wellbeing agenda. And they now have mental health ambassador programs where people can seek support whenever they need to. They have mental health as part of their cover on their health insurance cover. They have a My Story campaign where it is actively encouraged that people talk about their experiences in a non-judgmental, empathetic environment, opening up the conversation worldwide. And importantly, he's installed that every single frontline manager and HR lead has mental health first aid as standard. David also understood that through his experiences, he's become a better leader. He's more empathetic, and he's able to support people to succeed. In fact, John Flint from the HSBC group once stated that people that have recovered from mental illness are your company's biggest asset. They have the resilience, the resourcefulness, and the insights into people's dynamics that no others seem to have. So by supporting your staff with mental health, you're not only making your business more productive, you're helping your employees, and you're also potentially building better future leaders. So to summarise, you can use your words to potentially impact and save people's lives within your workforce. Focus not just on popular awareness months, but use a wider spanning health communication strategy that can lead to healthier and happier and longer lives. Prioritise mental health and physical health. Use communications. Encourage people to share their stories. And use advice to keep these communications alive. Consider starting a mental health ambassador program where people can easily seek the support that they need. Nurture a culture where mental health conversations should be open and non-judged, allowing people to be their true selves at work. And consider providing first aid mental health training for all your frontline managers and HR leads, so that they can support these conversations on the day-to-day. You can choose the way you use your words around mental and physical well-being to impact your workforce's life. Let's make it for the better.